Women seeking reliable birth control often choose an intrauterine device, or IUD. Though success against pregnancy is high, so it also turns out is the pain of insertion. Now some clinics, including Planned Parenthood, are offering sedation for the procedure. Boston Globe Today digital producer Jenna Perlman is following the story. Jenna, what led you to write this article about IUDs?
So I actually had a really bad IUD experience myself. A couple of years ago, I had an IUD put in and I threw up afterwards, which apparently happens to less than 10% of patients. And I threw up in a trash can and the nurse came up to me and said, "Thank you so much for throwing up in the trash can. A girl last week threw up on the carpet."
But Jenna, if it is so painful that it would cause a woman to puke, why get it?
It's the most effective form of birth control available. It's 99% effective in preventing pregnancy. It's also really reliable. It's in. You don't have to think about it for, sometimes up to 10 years, 5 to 10 years. And an IUD works it's a small T-shaped device. You insert it into the uterus through the cervix, and the whole process takes about 10 minutes, but women say it feels like it takes much longer than that. People also use IUDs to treat all sorts of hormonal conditions that you would maybe use birth control for, so like painful periods. But it is really painful, and that's a huge obstacle for people to deal with when they want to get the IUD. A doctor I spoke with said there's probably a lot of women that would want to get an IUD but don't because they're really afraid of the pain.
So with the fear of pain being at the top of mind for many women, what's being done to mitigate that pain or prevent it altogether?
Sure. There are a couple options. Doctors first and foremost say that people should take 800 milligrams of ibuprofen before they go in.
That's what I take for a bad headache.
Exactly. It doesn't necessarily always help. Studies show that say sometimes it helps, sometimes it doesn't. There's also another medication called misoprostol. It's used in medicated abortions, and it works by softening the cervix. Another study I found said it doesn't necessarily make it easier or better experience. There's also something called a paracervical block, which involves injecting a numbing agent into the cervix. That's also not, it's painful to get itself.
So you spoke to women for this article. Your experience, as troubling as it was that the norm for the women that you spoke with?
Well, first and foremost, everyone is different, so everyone had a different experience. But some of the women I spoke to said it was like a true 10 out of 10 and the most painful thing they've ever experienced in their life. One thing that really prompted me to write this story is that Planned Parenthood of Massachusetts is now offering sedation for people to do the procedure. So they'll essentially put them out with fentanyl, which is a pain medication, and Versed, which is an anti-anxiety medication. So they're not like completely out. They can still interact with the nursing staff. But they're, they don't really feel the pain and they don't really remember it. One woman I talked to said like she would have never gotten an IUD and never had been protected unless she had this option. But women really have had to advocate for themselves for this type of situation in the past at other facilities versus at Planned Parenthood, they'll say, what type of IUD do you want, and then do you want to be sedated? It's more like, we are offering this to you, you do not have to ask. The medical community has often faced claims that they downplay women's pain. And so an expert I spoke to said it's pervasive and commented like, why do women die more often from a heart attack? And that's just because their pain is either minimized or ignored or not treated quickly enough.
Jenna, if someone is thinking of getting an IUD, what type of questions should they be asking their doctor?
Sure, a couple things. First off, what type of IUD are you getting? There's two main options, a hormonal or non-hormonal. The non-hormonal is sometimes referred to as a copper IUD. So you want to know the pros and cons to both and what it'll do to your body. Secondly, what are my pain management options? What is offered to me and what will the procedure be like? Third, what's going to happen after? Some people experience cramping, not everyone. Your doctor should really inform you about what you'll experience from the following days, weeks, months, and how it'll affect your period. And then fourth, if you're using it for a contraceptive, not all women use it for that reason, but if you're using it to prevent pregnancy, when is it effective?
Boston Globe Today digital producer Jenna Perlman, thank you for your work on this story and bringing it to Boston Globe Today.
Great to be on this side of the camera.
For daily access to Boston Globe Today, all segments and episodes are available on demand in the Boston Globe app by clicking Watch.